Hi, my name is Taylor Smith, and this is my standardized patient reflection. So for my standardized patient experience, I only did in the booth looking at other people. I wasn't actually a patient myself, so I got to see everyone else interact with the patients, which I actually think was really beneficial because I got to see not just one different injury or illness, but I got to see multiple. So I was looking at three different injuries or illnesses at the same time, which I think was pretty cool because they were all different. And I think if I'd only done one, I wouldn't have gotten quite as much exposure or experience. Um, so watching different patient interactions, I just kept thinking about like what I would do differently or the same, which is kind of hard for me to do because I knew what the injury was every time the students interacted with the patient. So in my head, I'm thinking like, oh, you should do this, you should do this, you shouldn't do this. But obviously, if I'm the clinician, I'm not going to know what the injury is. So that's going to be a little different. But one of the big things that I caught on to first was especially watching Eric. He was really good about doing the little things, like sitting when you're talking to the patient, saying good job or great after you have the patient do something, like little things like that that don't necessarily change the outcome of the interaction, but it just makes you seem much more professional and confident. Like he looked like he knew what he was doing more than the other students, I think, because he did those little things. Like he knew his material well enough that he didn't have to think about that. He could think about the extra step that he could do um, in order to make that experience that much better for the patient. And I think that was probably the the thing that stuck with me the most was it's not just about treating the patient, getting the evaluation correct. It's about making the patient comfortable and letting them know that you're confident in your own skills, um, and you're confident in treating the patient themselves. So I think that was definitely the thing that stuck out in my mind the most. So it was really hard. Like it's hard for me sitting and watching the students interact with the patients because I want to tell them like, oh, you should do this, you should do this, you should avoid this because I know what the injury is. So it just got, I think the best thing for me about this whole experience was it got me thinking about what I would and wouldn't do in each different situation. And I was trying to think of how I would interact if I didn't know the end outcome. Like, okay, if I didn't know that it was a labrum tear, what would I think it was at first, and what would I do to try to find that out, and what like I would try to think maybe what would I personally think it was if I didn't know the outcome. So yeah, I think it was definitely I had a different experience from all of my other classmates because I wasn't a patient myself and I just watched everyone else. But like I said before, I honestly think that was more beneficial than being the patient myself because I got to see more scenarios and more students, which was good. But overall, the best thing for me was just planning in my mind, how would I respond? What would I do? And do I think what this student I'm watching right now is doing is correct? And would I continue doing what they're doing, or would I kind of change it up? So my experience was definitely different than everyone else's, being not a patient myself, but I think I got a lot out of it, and I think it was good for me to think about what I would do in each scenario, basically. So yeah.